Ever wondered why some kidney failures remain unexplained, even with advanced medical technology at our disposal? It's a question that has puzzled medical professionals and distressed patients for years. Kidney failure, a condition where kidneys lose their ability to filter waste from the blood, can be life-threatening if left untreated. But a significant number of cases remain an enigma, their causes shrouded in mystery. The prevalence of this unexplained kidney failure is not to be underestimated. It's not just a handful of isolated incidents, but a widespread issue affecting countless patients around the world. These individuals are left in a state of uncertainty, their conditions deteriorating, while the root cause remains unidentified. This lack of a precise diagnosis makes it difficult for doctors to devise an effective course of treatment, leaving patients and their families in a state of perpetual anxiety. Current diagnostic methods, while advanced, have their limitations. They often involve analyzing the patient's genome, looking for faulty areas that could be causing the kidney failure. But what if the problem isn't a faulty gene, but a missing one? Could our genetic pipelines, designed to detect errors, be overlooking these gaps entirely? This is not just about medical curiosity, it's about people's lives. Every day, patients with unexplained kidney failure face the daunting reality of a disease that is slowly but surely taking away their health, their vitality, their dreams. They deserve answers. The lack of a precise diagnosis has been a significant hurdle in treating unexplained kidney failure. But what if we told you a breakthrough might be on the horizon? A new method of analyzing genomic data that could finally shine a light on these unexplained cases. A method that could give hope to those suffering from this mysterious ailment. But more on that later. For now, let's delve deeper into the mystery of unexplained kidney failure. Enter the new genomic method, a revolutionary approach in diagnosing unexplained kidney failure. This approach is a game changer, shedding light on an area previously cloaked in mystery. It's like a detective discovering a new piece of evidence that cracks the case wide open. So, what is this new genomic method? Simply put, it's a fresh way of analyzing genomic data. It's a method that allows us to delve deeper into the genetic code, uncovering previously hidden genetic anomalies. This is a significant discovery, enabling patients with unexplained kidney failure to finally receive a diagnosis. Let's take a closer look. Scientists at Newcastle University have worked with data from the Genomics England 100,000 Genomes project to establish a diagnosis in patients with unexplained kidney failure. What they found was that certain areas in their genome were missing, and as a result, were not detected as faulty when using the routine genetic pipelines to analyze data. This discovery is like finding a missing piece of a puzzle. The scientists identified a missing gene, and within it, they found mutations. They've been able to classify this as NPHP1-related kidney failure. It's like discovering a new species in a vast genetic jungle. This new genomic method is not just a scientific curiosity, it has real-world implications for patients and their families. With this new method, patients can receive a precise diagnosis, which allows their investigations, treatment and management to be tailored to their needs. The beauty of this approach is that it can be applied to a wide range of cases. For instance, experts reviewed genetic sequencing data from 959 patients with advanced kidney disease. Of these, 11 patients were identified as having a deleted region genome, leading to a complete loss of a kidney gene that had previously been undetectable. This new method has opened doors to a more precise diagnosis, paving the way for better treatment outcomes. It's like a ray of hope piercing through the clouds of uncertainty, promising a brighter future for patients with unexplained kidney failure. The implications of this new genomic method are far-reaching and transformative. Now let's dive into how exactly this method could change lives on a grand scale. At the heart of this breakthrough is the ability to provide patients with a precise diagnosis. No longer are these patients shrouded in uncertainty, unsure of what exactly is causing their kidney failure. This new method can pinpoint the missing gene, NPHP1, and identify it as the culprit. This is a revolutionary step in genetic medicine, opening the doors to a whole new world of understanding for these patients. Now, why is this so important? Well, having a precise diagnosis paves the way for a tailored treatment plan. It's like having a map to navigate the complex terrain of kidney failure. With the exact cause identified, doctors can construct a treatment plan that addresses the specific needs of the patient. This could mean the difference between a life of uncertainty and a life of managed care, between unanswered questions and clear explanations. But the benefits extend beyond the individual patient. The discovery of NPHP1-related kidney failure has broader implications for the medical community as a whole. It's a reminder that it's always worth investigating the underlying reasons for kidney failure to get to the bottom of the condition. It's a call to action, a challenge to dig deeper and uncover the genetic causes of disease. Furthermore, this discovery can impact not just the patients but their families too. Consider this: if a family member wishes to donate a kidney to a loved one, knowing the genetic cause of the kidney failure can provide crucial information. It can help determine whether the donor is a suitable match and whether they themselves are at risk of kidney failure. So you see, this new method isn't just a scientific breakthrough, it's a beacon of hope for patients and their families. It's a tool that can bring clarity in the face of uncertainty, and a guide that can lead to more effective treatment. By giving a precise diagnosis, this new genomic method has the potential to significantly improve the lives of patients with kidney failure. To truly understand the impact of this new method, let's explore a real-life case: the Bingham family. Meet the Binghams, a family hailing from Hexham, Northumberland. They're a trio, all grappling with the same affliction: kidney disease. The siblings, Noah, Ariel and Casper, have been living under the shadow of this ailment. Noah, the eldest at 23, and Ariel at 19, have already undergone kidney transplants. Meanwhile, Casper, the youngest at 15, has recently been diagnosed with kidney disease. The onset of kidney failure didn't come with a warning. Noah was hit with the news right after his A-levels. Around the same time, Ariel was receiving treatment for reduced kidney function. And just when they thought they had seen it all, the youngest, Casper, was diagnosed with the same disease. They all had their own battles to fight, but they stood united, navigating through the murky waters of this life-threatening condition. The Bingham story, however, isn't just about the struggle. It's also about hope, discovery, and the power of genomic medicine. Their participation in the Genomics England 100,000 Genomes project turned their lives around. The project, employing the new genomic method, identified a gene deletion in the family, diagnosing them with NPHP1-related kidney failure. This was a breakthrough. For the first time, their condition had a name. For the first time, they had answers. The implications of this diagnosis were significant. It wasn't just about a name, it was about understanding their condition better, and consequently finding more effective treatment options. It was about moving from the unknown to the known, and from hopelessness to hope. The Bingham's journey is a testament to the transformative power of this new genomic method. It's a story of resilience, of scientific breakthrough, and of a family who, despite their genetic misfortune, found answers and hope. The Bingham family story is just one of many that highlight the potential of this new genomic method in transforming the way we diagnose and treat unexplained kidney failure. So, what does the future hold for diagnosing unexplained kidney failure? As we delve into the potential of this new genomic method, we see a horizon teeming with possibilities. This breakthrough is not just confined to kidney failure diagnosis, but it has the potential to revolutionize the way we identify and treat numerous other genetic disorders as well. The work of the dedicated scientists at Newcastle University has not stopped at the discovery of this new method. They are currently working with cell lines taken from patients to study the disease process in more detail. This will not only provide a deeper understanding of how these genetic disorders develop, but also pave the way for potential treatments. The beauty of this genomic method lies in its precision. It's like having a finely tuned instrument that can pick up the faintest notes in the symphony of our genetic code. This means that doctors can provide a more accurate diagnosis, leading to tailored treatments and management plans. It's not just about treating the symptoms anymore, but about understanding the root cause and addressing it head-on. Moreover, this method has shown its potential in diagnosing other previously unexplained conditions. For instance, It was used to make new genetic diagnoses in cases of unexplained deafness and blindness in the UK. This hints at a future where the mystery behind many unexplained genetic disorders could be decoded, providing relief and answers to thousands of patients and their families. The implications of this discovery stretch far and wide. It has the potential to change the narrative for patients with unexplained kidney failure and their families. It could mean the difference between uncertainty and a clear diagnosis, between a one-size-fits-all treatment and a personalized care plan. With the advent of new genomic methods, the future looks promising for patients with unexplained kidney failure. With continuous research and innovation, we are on the brink of a new era in medical science where the unexplained can finally be explained, and the unsolvable can finally be solved.